We are experiencing an epidemic of bruxism, and there are some articles about it. Speaking of this terminology, the epidemic of bruxism, such a large number of patients are coming to our office with bruxism, and at the same time, you find a bruxism guard on Amazon. So it doesn't make sense. The question is how you are going to position yourself in front of this. Remember when I told you about apnea? Obstructive sleep apnea affects 50 million people in Brazil, and only about 10% are diagnosed. And mild apnea is treated by us with a protrusive splint. You can improve your patient's quality of life. Be careful not to be living in the past. The new dentistry, 360-degree dentistry, dentistry with 360 record, will bring the answer to what you are looking for. It will set you apart from the majority. It will make you stand out. And this is the diagnostic splint exam associated with the polysomnography exam, which are the differential complementary exams, which are the exams for bruxism. I published it in 2019. I live this every day. I just provided a diagnostic splint here. I just delivered the diagnostic splint to the patient. And this moment is when I want you to change your perspective. You can see how profitable this is with integrity. It's about integrity. It's about delivering what the patient needs. And in the polysomnography, we see if there is or isn't related apnea. And this patient who came to me, remember, I was talking about the patient who came because of bruxism. She makes this level of movement associated with several desaturations. Can I tell you a little secret? The patient didn't know she had apnea. This patient didn't know she had apnea. Who discovered it? The dentist. So she has apneic events. She causes this level of wear on the diagnostic plate and is a patient with moderate apnea. I explained to her, like, light sleep, most of her sleep is light. Yeah, her deep sleep, 24, REM 27, it's not even that bad. Her REM sleep, but the light sleep also very dominant and mainly an associated apnea. In short, I did everything for this patient. I adjusted the environment. I did Invisalign because I didn't want to wear down her tooth, her central one that was crowded. I did everything with great rigor. There was no need to treat any root canal in this rehabilitation. I opened the spaces, redistributed. Look, I did all of this in conjunction with bruxism treatment. Why? You can't just follow up on the tooth and refer someone else to treat bruxism. Who is going to treat the bruxism? Are you going to refer them to the TMD specialist? She doesn't have pain. She doesn't have pain related to bruxism, and bruxism is not TMD. So if you leave this patient in limbo, not knowing how to treat her bruxism, she will go a long time without a splint. Because a splint, besides not being the main treatment, you will be using Invisalign, which most likely a patient with untreated bruxism will not be able to use. She will be lost in relation to bruxism. And you will be touching your teeth. But you can treat it and provide a better quality of life for the patient. So I expanded then 8 trays just of aligners. Of course, I did the adjustment of the environment before the aligners, bruxism treatment, Invisalign whitening. And the next steps then are the whole part of teeth. So if you want to know more about these topics, start following me and share with more dentists.